Bilirakis, 5 minutes for your questions, please.
Thank you, Mr. Chairman. I appreciate it. Thanks for holding this very important hearing. Ms. Stewart, as a parent, I remember the birth of my children. It was such a joyful event. The idea that rates of maternal mortality are on the rise is horrifying as far as I'm concerned. In our state, it's on the rise. I've read that women are dying from hemorrhage complications in the state of Florida. How does the Preventing Maternal Deaths Act help reverse the trend of women who are losing their lives due to these typical medical complications?
Well, I'll defer to my medical colleagues to describe the issues around hemorrhage and how this is contributing, but I will say this, that what this bill is designed to do is to establish across the country maternal mortality review committees that are designed to collect data on every maternal death and to make sure that every state understands the underlying causes of death for each woman that dies as a result of childbirth. But even beyond that, what it's designed to do is to not just collect the data, but to help states and to help the participants in the healthcare system design interventions that can actually eliminate deaths in the future. And that's one of the things that's really important about this bill, is not only collecting the data, but then designing interventions. And of course, if we collect data consistently across the country, and if the sharing of interventions can also be shared, we can certainly accelerate our ability to reduce and even eliminate maternal deaths. I'll give you a couple examples of how collecting data in MMRCs has been really helpful. In Colorado, for example, data was collected, and what was found is that women that experienced maternal death had also been experiencing suicide and depression, and they were, in Colorado, able to find and identify where there were gaps in mental health services and actually close those gaps and give more mental health care services to women where they needed it. In Ohio, they actually did something which I think is really important, which is do additional training for hospital staff, beyond just the doctors themselves, hospital staff, where they went through simulations of training in obstetrical emergency situations so that they could actually be more responsive in the event of an emergency situation. So MMRCs are not only about collecting the data, but actually putting into action the things that can actually eliminate maternal deaths, and that's why this bill is so important, and that's why a national bill and a national effort is also so important, so the data can be consistent, it can be collected, we can see the data, we can actually track the interventions more successfully.
Thank you very much for that answer. Dr. Coslet-Charleston, according to the Centers for Disease Control and Prevention, it lists indicators: severe maternal morbidity has steadily been increasing in the years. What are the key drivers of this increase, and how can it be addressed?
Well, some things are recognizing and being able to maintain proper prenatal care and care of women throughout the reproductive years, and identifying comorbidities such as, we talk about obesity and smoking cessation, and where we see a rise in comorbidities with heart disease. So having active interventions before pregnancy, we find, is critical to having a healthy labor and delivery for all women.
So you feel that they are increasing? I mean, in this day and age, with all the technology we have, or is it just that we're getting more data on this, or there definitely are increases in maternal deaths?
Well, so far, that's part of the purpose of this this review, is so that we were talking earlier about the accuracy of the data. So some speculation has been made that perhaps because for the past 5 years we were actually recording on death certificates whether or not a woman was pregnant when she died or within a year after delivery, whether or not that has caused a rise in the actual numbers that we're seeing. But when comparing to other countries that have had similar check boxes on their certificates where they've seen a stabilization or a decrease, we've actually seen an increase. So these committees are really imperative to really, exactly what you're saying, really know and be able to assess and accurately determine if those disease entities, as well as true maternal death, if there is a change, and make sure that we have accurate data so that we can successfully portray appropriate interventions.
Yeah, exactly. So whether it's increasing or what have you, we have to focus on the issue. There's no question. And Dr. Johnson, you have my sympathies. I was in the VA committee, so I didn't get a chance to hear your testimony, but I know how difficult it must be for you. Let's see, Dr. Perry, please. Our maternal mortality data has been described again as limited, unreliable, and even embarrassing by top researchers. Do you agree with these characterizations? And I know, let's expand upon this. Are there concerns with the research community regarding the integrity of the data being collected in states? What are those concerns and how might they be addressed federally?
It's me. It's okay. Hi.
Oh, you're over here, I'm sorry.
Yeah, so it's important. Dave Goodman and the folks at CDC are doing a great job of doing the data. They've been doing it for a very long time. They've dedicated their life to it. And they've looked at if the increase is due to error in data versus if it's an increase that's true. And all the studies so far have come back saying, no, there is an increase and it's from the data. And so the robustness with which the CDC is working on to look at this issue is something that we should all value, and that they're part of this bill. They're not here testifying, but CDC is really integral to getting this work done, and it's important that we understand that yes, there have been researchers that have given us pushback around the data over the years, but we've gotten better and better, and this is just another way to get even more clear about how women are dying, because we can get on a granular level and look at the hospital level what's happening. So yes, there have been a lot of articles about the data, but we truly know through the CDC that the rates are increasing and that we can do something together to do it better with this bill.
Very good, thank you, and I yield back, Mr. Chairman.
Chair, thanks, the gentleman. Gentleman yields back. The chair would just make the observation that I believe it was Dr. Callahan from the CDC who came and spoke at one of our roundtables about a year ago, and you're correct. They are very thorough, and they have been at this for a long time. They've got a lot of good insights. Chair recognizes the gentleman from Massachusetts, Mr. Kennedy, 5 minutes.